Hello everyone, I am Avilash Banerjee and you are watching Achievers Biology.
Okay, the troponins are basically protein components of the striated muscles, and there are basically three types of troponins: that is troponin C, troponin I, and troponin T, which will be also called to be as Trop C, Trop I, and Trop T respectively. If we see this Trop T, it is having 84% sensitivity in case of myocardial infection in the 8 hours. Then he will decrease up to 81% on the onset of symptoms. In case of Trop I, it is up to 90% sensitivity. In case of myocardial infection and in onset of symptom, it will be 95%. So low specificity for unstable angina, it will be seen in Trop I cases. So if we discuss the differentiation of Trop I and Trop T, which is better and how, in which way, for diagnosis purpose, we will see that in case of after the cardiac surgery, significantly the different result can be expected from these two assays with the Trop I and Trop T. This Trop I reaches much higher levels than the Trop T in this after cardiac surgery. In case of heparinized plasma samples, these samples allows more rapid analysis than the serum samples. But preliminary studies shows that lower Trop T results in plasma occurs. These negatively charged polyanions of the heparin, is the present of this negatively charged polyanions on the heparin binds to the positively charged troponins. So the early phase of myocardial damage, Trop T occurs mainly as a free cytosolic form. In the later phase, it occurs in the structurally bounded form and fragments. The Trop I is primarily released into the plasma as a binary complex with the Trop C, and later occurs as a distribution of variety of forms. What I have said I will repeat again. In early phase in the myocardial damage, Trop T mainly occurs as a free cytosolic form. In the later phase, it occurs, that is the Trop T occurs as structurally bounded form and in fragments. Trop I is primarily released into the plasma as a binary complex with Trop C. Trop I binded with Trop C in primary released form, and later it occurs as a distribution of variety of forms. The cardiac Trop T has a higher overall tissue concentration and free cytoplasmic concentration than the Trop I, and appears in blood of patients with acute myocardial infarction as a mixture of the complex of Trop T, I, and C, and free Trop T. The cardiac troponin I is more hydrophobic, that is the Trop I is more hydrophobic and appears in the blood predominantly in the binary complex of IC, that is the Trop I and Trop C binary form, with smaller amount in the tertiary form, that is the Trop T, Trop I, and Trop C complex. More form in the binary form with C, that is the Trop I and Trop C, and in smaller amount it bounds with Trop T, Trop I, and C form. Degradation of these complexes leads to the faster clearance of the protein. Troponin I is higher sensitive compared to Trop T relatively in all types of assays. So Trop I is slightly more reliable than other Trop T and Trop C. Trop T level is more elevated than Trop I in patients with the chronic kidney disease, even at baseline samples. The disadvantages claimed by the cardiologist for the Trop T may turn into an advantage for nephrologist. The Trop T that having the disadvantages leads to The advantage is in case of nephrologists, because in kidney disease, Trop T level became more. Trop T in the blood sample not be frozen or refrigerated immediately. And it can be stored in room temperature up to 8 hours for analysis. In recent research shows that the cardiac Trop T quantitative as a failure as a result of antibody interference, whereas the Trop T as a complete may compete with the antibody as a reagent for the binding site. It competed with the reagent, antibody as a reagent for this binding site. Troponins are mainly bound to the myofibrils. They allow 6 to 10% of the Trop T and 2.8 to 4.1% for the Trop I in the cytosol. The troponins can rise due to the ischemia without the necrosis. In case of necrosis, if necrosis happens, this can also have some effects on this, so interfere with that. So troponins reaches the highest in case of ischemia. About 94% of the troponins are affected to the contractile unit and released in case of myocyte dies. If the myocyte, the myofibril cells, if dies, then it releases from the myofibril cells. Therefore, a large amount of troponin T is free in the cytosol than the troponin I. So the more release of this Trop T, it can be a sign of typical necrosis. That is the typical damage of the myocyte cells. Is the release of Trop T, whereas Trop I releases in case of necrosis. So here we can find that the elevation level of Trop T than the Trop I signifies the myocyte cell damage or death of these myocyte cells, whereas the elevated level of Trop I also signifies the necrosis. So that's all for the different types of Trop I and Trop T differentiation. These two type of troponins are most important, troponin T and troponin I. Also troponin C is present, which is found in rounded form. But in case of, there are also some, as we have discussed, that cardiac markers present, CKMB, CKNAC and myofibrils. They also have different effects, but for the myocardial infection, it is better to have the test for the troponin T. Hope you all like this video. Thank you everyone. Please do like and subscribe the channel and share this video. Thank you.